وسهلا بكل الذين ينضموا للاستماع إلى راديو بلدي أول راديو عربي أمريكي ويعنى بقضايا العرب في المهجر. برامجنا في راديو بلدي كل يوم جمعة من 8 وحتى 9 صباحا مع ليلى الحسيني في بث حي ومباشر وعبر WNZK راديو 690 AM. صباح الخير بلدي، صباح الخير لكل مستمعينا.
Welcome to Radio Baladi, the first Arab, Middle Eastern, and American simulcast radio show. Radio Baladi is broadcast every Friday morning on WNZK 690 AM from 8 until 9 Eastern Time on Good Morning Michigan with Layla Al-Husseini. Our call-in number 248-557-3300. And now, stay tuned for the best radio talk show on Arab and American issues with your host, Layla Al-Husseini.
Imagine you're on a train track. Somewhere miles away, a train is headed your way. You can't see it yet, but it's coming. Slowly but surely. If you have prediabetes or you're at risk for type 2 diabetes, you may be on the wrong track, and diabetes could be heading your way. Bit by bit, the danger is getting closer and closer. So should you stay on the track you're on now or move to make a change and reduce your risk? If you have prediabetes or you're at risk for type 2 diabetes, you may qualify for the National Diabetes Prevention Program in your local community. This one-year program could be the ongoing support you need to put you on the right track. Not only did participants lose weight, they cut their risk of type 2 diabetes in half. Ready to get on board for a healthier future? Learn more about the National Diabetes Prevention Program and what else you can do to manage and prevent diabetes at michigan.gov/diabetes. A message from the Michigan Department of Health and Human Services.
Good morning, and thank you for being with us. This is Khalil Hachem with the local connections from US Arab Radio and Michigan.com. Michigan.com provides real estate news, business news, mortgage news, and recipes, and much more. Please visit us at www.michigan.com today for current news and information. Thank you so much for being with us. We're glad that you're with us. The COVID vaccine and the COVID cases, the pandemic. And the number here is 248-557-3300. Should you have any questions or comments, please give us a call in Arabic or in English. We'll be more than happy to share your thoughts with us if you want to share your thoughts with us. And we're going to continue with Melita Jordan, Director of Wayne County's Department of Health, Human and Veteran Services. She's a very active member of community, and she has been leading this effort in Wayne County to provide effective remedy or effective solutions for COVID-19. Good morning, Ms. Jordan.
Good morning. How are you?
I'm fine. How are you? Thank you so much for taking the time to be with us.
It's an absolute pleasure to be here, and thank you for inviting me.
Absolutely. We would like to help our community understand, the numbers are going up, okay? We need more people to get vaccinated. If you want to give us more or less, what's going on in the county.
Absolutely. And you're absolutely right. Our numbers are increasing. Over the past week, we actually had a total of 1,148 new cases reported in Wayne County. And so that really has been a 21% increase in confirmed cases from August 1st through August 7th. And so we are in the community with a real canvassing program in terms of working with our community leaders. We're working with our faith-based organizations, our nonprofit organizations, trusted leaders throughout the county to get the word out. We have mobile pop-up vans. We have sites within the community to make sure that we have ample access for people to come in and get vaccinated.
That's wonderful. And how successful are we?
We are making tremendous amount of success. As a matter of fact, we have 61% of our population has been vaccinated over the age of 40 to 45, and we have our seniors, those that are above 65, more than 70% have received first and second dose of the vaccine, which is excellent. Our goal is to make sure that as we continue to do continuous outreach, we really are focused on our younger population between 12 and 15 years of age. We have approximately 39.8% that have received the first dose and 32.9% of that age group who have been fully vaccinated. And for our 16 to 19-year-olds, we have 56.9% that have received the first dose and 49.6% who have been fully vaccinated. So again, as we look at this, we're really pleased to see that, as I mentioned earlier, between our 65 and 74-year-olds, 87.7% has been vaccinated with the first dose and 83.3% with the second dose fully vaccinated. So we are certainly making progress, and we are continuing to, like I said, work in the communities to address all populations that have not been vaccinated.
Absolutely. You know, we as part of our effort to really help you with what you do, just want to make sure that everybody understands what's going on. First, and correct me if I'm wrong, is if you don't have insurance, you can, and the vaccine doesn't cost anything, you can get vaccinated. Is that correct?
That is correct. We are providing vaccinations to everyone free of charge. It doesn't matter where you go in terms of if you went to a CVS or if you went to a Walgreens, if you went to a Target, any of the pharmacies also, the COVID vaccine is free. No one should be asking for any form of payment for the COVID vaccine. And again, as I mentioned, we have sites in at Bellevue, Wayne County Community College, sites in Canton, Highland Park, Harper Woods, Lincoln Park, River Rouge, at our high schools. So we are in the communities with, as I mentioned, buildings as well as mobile vans, and also going door to door, informing our residents that the vaccines are available and they're free.
Absolutely. So people should not get scared if they ask you for, whoever is administering the vaccine, if they ask you for your insurance card. If you have it, fine. If you don't have it, you still get the vaccine. Now, what if I lose my card? How can I replace it?
If you were to lose your vaccine card, or if you, is that what you're referring to? I'm sorry, I want to make sure I'm clear about the question.
Vaccine card, yes.
If you lose
somebody send in this question, what if I lose my vaccine card? What can I do?
Sure, contact the our Department of Health here, and we can make sure that we provide you with the information to get another one.
Wonderful. And what's the number there?
I will give you the phone number. Give me 1 second. Of course, that was one piece of information that I did not have right in front of me.
That's all right. That's all right. We can get it. At the end of the interview.
I'll get that just real quick to you. But yes, if you call the health department, we can make sure that you get another card if you happen to have misplaced it and need a replacement.
Absolutely. Okay. What if I don't have? I'm an illegal resident of the area. Can I still get vaccinated?
Yes, you can. You can still be vaccinated. And our number is 734-727-7100. Again, that's
734-727. I'm sorry, go ahead.
7100.
7100. Wonderful. So, because they ask you for an ID, they ask you for things like that. Even if you don't have those, you can still vaccinate it?
You can still get vaccinated.
Okay. Wonderful.
Yes, we have no barriers against you being vaccinated at all. We want to make sure that we are making everything accessible to everyone in terms of being vaccinated. So if there's any issues or you encounter any problems, please feel free to give us a call here at our department, and we can provide additional information and direct you to where our sites are. And we also have in-home vaccination. I want to make sure I share that. Again, if you give us a call, we can also get you scheduled at that same number. If you call the 734-727-7100, we can actually come out to your home and provide the vaccination as well. So we do have in-home vaccinations.
Yeah. Now, the Delta variant is making life tough for medical staff. Is it really scaring people enough to get more vaccines?
Well, I think people are very concerned. I think, as you well know, it is on the news every day, and some states are more impacted than others. I'm sure we've all been watching the news outlets and, again, hearing that there is a surge in certain states. And, again, with that information, people are very concerned. We have identified 38 cases to date in Wayne County. However, we do have other variants such as the B117. That is the detection was from the United Kingdom. That was approximately in our vicinity 1,439 of the B117 that has been identified. The B1351, the South African variant. 11 has been identified here in the county thus far, and B1429, which is the Epsilon or the California variant, 25, and the B1 Gamma. We have 40 that has been identified in the community, and Delta, as I just mentioned, which was first detected in India, we currently have 38. So we have a total of about 1,561 variants of concern that have been identified in Wayne County.
It seems the Delta is the worst one, isn't it?
Well, the Delta variant is causing is a variant that is very strong, and it's mutating very quickly. So that is a major concern.
And when the talk about booster shots, how do we know who really needs them, and would somebody get in touch with them, or do we have to get in touch with you as a health providers to do that?
Well, we're currently working on a plan for the booster at this time, and so we will be sharing some information about that in the coming days.
Absolutely. What else can we do to convince our people in our community to, the different communities as well, that, vaccination is a good thing and you need to get it?
Well, again, as you well know, we are working with trusted leaders within the community to let people know that the vaccine is a safe. And again, receiving the vaccine will certainly reduce the risk of becoming severely ill and or being hospitalized that would require perhaps being put on a ventilator. So the vaccine has certainly been demonstrated and has been proven through scientific efforts that your previous guests have spoken about in terms of reducing the risk of a severe illness.
Absolutely.
And so we're trying to encourage as many people as possible to get vaccinated, because this is a way of making sure that you can not only maintain your own health, but also maintain the health of family members and within the community, that we can reduce this spread.
Yeah. Are more children getting sick now than before?
I don't have data in front of me to suggest that we have, when you say more sick, we need to look at the parameters of meaning that what do you mean by more sick? Are more kids developing or been diagnosed with a positive COVID and or more respiratory infections, becoming ill because of the COVID virus? And so we are seeing nationally, we are seeing some increases clearly as it relates to children being impacted by COVID. So therefore, we are watching that across the country as well as here in terms of how many children are developing upper respiratory infections that is caused by the variant and or caused by COVID and or perhaps caused by an upper respiratory infection.
Absolutely. Do we have more efforts on, we need to educate people, like the pandemic is not over. Vaccine is necessary. What else can we do to really fight the pandemic?
Again, we can continue social distancing, wearing a mask. In addition, washing hands. Following those practices will help us reduce the spread of COVID. So it is very important that when we are in a concentrated area with lots of people, that we still mask up if you either are vaccinated or unvaccinated. It's to have a mask on. Also, we are recommending a mask when you're inside, when you're indoors, and that is one of the recommendations from the Centers for Disease Control is to have a mask indoors if you are vaccinated and or unvaccinated.
Absolutely. You know what weighs a lot on my mind personally is I'm vaccinated, my wife is, my son is, but my daughter is not. She's 10 years old. And I've always, like, when I go out and come back, and I'm always thinking, you know, I hope that I'm not bringing something home with me because she's not vaccinated. So wearing the mask really is going to help, as you said, in keeping, young people as safe as possible. Is that correct?
Absolutely. And again, practicing, safe measures at home in terms of, like I said, frequent hand washing. If someone is sick, then again, trying to minimize direct contact is important so that you are limiting the spread. As you know, when we talk, we have air droplets, and so therefore it is passed in the air to another individual if they're standing very close to you. So again, we must make sure that we are practicing safe measures at home. Like you, I have a daughter, and I have a daughter that actually has multiple sclerosis. And so I, too, am concerned at times when I am out and then come home and I am with her. I need to make sure that I am always practicing precautionary measures. I actually wear a mask when I visit her, as well as making sure that if I am coughing or have a, not feeling well, I make sure I actually stay away from her, just so that I am protecting her as well as keeping her as healthy as I possibly can.
Absolutely. Is there anything I haven't asked you that people need to know?
Again, I want to share it again. Like I said, we have the sites, and I want to make sure that, we can let people know that we are throughout the community in all of our areas. As I mentioned, in Highland Park, we're in Hamtramck, Eastcourse, Flat Rock, Harper Woods, Lincoln Park. We are throughout the area, and so we are in the communities and will continue to stay in the communities, providing information, speaking at community events, and so we welcome the opportunity to participate as you have invited me this morning. Welcome the opportunity to participate to various organizations so that we can talk about, as well as make sure that we can reach communities and provide vaccinations right within their communities and or their homes.
Wonderful. I really want to thank you for taking the time to be with us, and I want to thank you for all you do, all the diligent work that you do to keep us safe. And also would like to recognize Ms. Stephanie Jackson, who arranged for this interview. I think, is Ms. Jackson with us still on the phone?
I am, Khalil. Thank you so much.
Absolutely. Thank you so much. And I want to pay tribute to your father as well, and who was a great friend of this community. So I want to thank you all for being with us. I really appreciate your time and your efforts and all you do to keep us safe.
Thank you very much, and have a great day.
Thank you.
We've been staying safe at home. Scientists have been on a journey. The destination, a COVID-19 vaccine. This journey began decades ago with research into other coronaviruses. Scientists built from there with months of research and development, cooperation with other experts worldwide, and clinical trials on tens of thousands of volunteers of diverse race, age, and health status. They arrived at a safe, effective vaccine, and hundreds of thousands in Michigan have already been vaccinated. But the next step is ours. We need to get the vaccine when we can. Keep wearing masks correctly and taking precautions until we reach our destination, freedom from COVID-19, and getting back to the lives we love. Discover the facts for yourself at michigan.gov/COVID vaccine. A message from the Michigan Department of Health and Human Services.